and welcome to Cleveland Schmooze, a podcast about Jewish Cleveland. We're your hosts. I'm Rachel Rood.
And I'm Robin Rood.
And today we're going to be talking to Dr. Michael Rabovsky, a family physician at the Cleveland Clinic. And he joins us now to talk a little bit about his life growing up Jewish and a little bit about how family doctors are crucial parts of the front line against the pandemic. So thank you so much for joining us, Dr. Rabovsky.
Thank you. Thanks for having me.
So we start every podcast by asking our guests to just tell us a little bit about their Jewish upbringing. So what was it like for you?
Well, I grew up in Baltimore.
Okay.
Baltimore is a lot like Cleveland in terms of the Jewish community, very strong Jewish community that tends to be concentrated in one area of the city. Judaism was important from as long as I can remember. We went to, like other folks, we went to Hebrew school. I continued after Bar Mitzvah to what was called Baltimore Hebrew College, which would be similar to like Siegel College here.
Gotcha.
And was just part of our family life.
Where did you grow up? Reform, conservative?
Actually, we grew up in an Orthodox shul.
Oh, wow.
I think it was a time when those denominations weren't as important when you talk to other people. It was, initially we lived in Baltimore City near Pimlico Racetrack, which is part of the Preakness for racehorse fans.
Oh, cool.
And it was a small Orthodox shul that we went to. And then we moved out into the county as the Jewish community moved out into the county, and also was in a more modern Orthodox shul.
So you guys kept Shabbos, did you keep kosher?
We kept kosher, and that was very important. I went to shul on Shabbos, but I wouldn't say we were Shomer Shabbos.
Got it.
My father had to work on
Right.
some Saturdays.
Right. Back in the day, it was traditional.
Yeah, I mean, it was an Orthodox shul where people drove to shul and parked on the street because the parking lot was closed.
Okay.
But still, had all of the Orthodox traditions.
Did you remember enjoying being Jewish when you were younger and keeping the traditions, keeping the holidays? Like, was it something where you were, jealous that you couldn't have a cheeseburger growing up?
Actually, never felt that way, no.
Yeah?
Yeah, no, the holidays were important.
Uh-huh.
Friday night, we always had, Shabbos was always the best dinner of the week, and everybody was home, and that was just expected that we be there. We saw family a lot, after dinner on Shabbos. Holidays were always important. I don't think I ever missed a holiday, even in college. I went to college in Philadelphia, University of Pennsylvania, which is only about a 2-hour drive. And I think looking back, I was home for every holiday because that was important and family was around.
I remember our Passover. My grandfather and my uncle did the entire Seder in Hebrew. There wasn't a minute of English at all. Was that similar in your family?
Pretty similar. Pretty similar initially. As my sister and I and my brother got a little older, we tried to introduce a little English. I remember once my uncle saying, "What are you doing? Come on, let's just get done with this." 15 minutes we're having, we're having matzo ball soup.
It was very quick.
Yeah, it was very quick.
Did you really enjoy Jewish food growing up?
Oh yeah.
Like, what was one of your favorite dishes?
That was all we had.
Right.
was Jewish food. Oh well, probably pastries. The apple strudel, the cakes my mother used to bake.
Yeah, the ruglach and mandelbrot.
That's great. Would you consider yourself Orthodox today?
No, again, I think, I don't know how this happened, but I've mentioned this to my wife and others, that label of being Orthodox or conservative didn't seem to be as important growing up. No one really seemed to care. I think as a community, we seem to be a little bit more stratified with those labels, which I don't think is necessarily good for the Jewish community as a whole.
Right.
I would say we're traditional. We keep kosher at home. We'll go out to restaurants, but I guess I have my own rules. Well, I'll go out to restaurants, but typically I eat fish. I don't eat,
Right.
Right.
you know, pork products or shellfish. You know, when we were growing up, our kids wanted to know why they couldn't go out with friends on Friday night, and we said you had to have dinner with us first. So we always had that kind of tradition. Most Shabbat, I come to the temple in the morning.
That's great. And where do you
If I
belong
can.
here?
Yeah, we come
To
here.
B'nai Sharn?
B'nai Sharn, yeah.
Wonderful.
When I
sorry.
moved to Cleveland and got married, my wife's father was the president of this, had been the president of the synagogue.
Right. We
who looked at
interviewed
me-
him and Michael. for-
Michael and my brother-in-law was president
yeah,
as well.
for the
Right.
documentary that we made.
Right, in
Right.
2010 or something.
So I remember
like that.
he looked at me and he goes, "You can join any temple you want in the city, but you have to join B'nai Sharn."
Give you a choice.
That's
Yeah,
great.
I wasn't going to pay temple dues for two. So
So I'm curious if there's any doctors in your family.
no,
So what made you interested in becoming a doctor?
you know, I'm not really sure. It was, you know, kind of one of those things, you know, you always hear, you know, we always heard, oh, you know, study hard and things. You could be a doctor, you can be a lawyer, you can be a
Really?
professional. I always thought about wanting to do that. I always thought it would be something that I liked. When I went to college, I wasn't sure that's what I wanted to do. But I made sure I had all of my science courses and things. And then I got a job working as a nursing assistant in a hospital in Philadelphia, Thomas Jefferson.
Oh,
And I really liked it. And I really got an appreciation for what I would say, for not only what doctors do, but the nurses and how hard they worked and how much responsibility they have. And I thought, yeah, I can do this.
And specifically family medicine, because it's not, you know, the fanciest of specialties. My dad, obviously, you know, Dr. Markard, so we know that, you know, that it's not always someone's first choice as a specialty. Why did you want to become a family doctor?
Well, I think going into med school, that was just what I thought a doctor was. I guess that was my exposure to what doctors were. And I just thought that that would really be, you know, what I had always thought about when I wanted to be a doctor. It was the Marcus Welby syndrome. If you,
right.
Marcus Welby was a
Did you enjoy the whole
TV doctor.
Right. Did you enjoy the whole cradle to grave? You treat a family, every member from
Yeah.
Like that concept?
yeah.
Right. So when it came to sort of choosing a specialty, I knew I wanted to do primary care. And I really liked the idea of being able to do the full spectrum,
Right.
seeing
That's great.
infants, seeing adults, doing geriatrics.
That's
And
wonderful.
so that's why I chose family medicine.
How did you get connected with the clinic then, from the different places you went to school?
Well, I went to medical school, University of Maryland, and I came here for K's for residency. Does that sound familiar?
Yes, it did.
It had, you know, when I looked around at different residencies around the country, it had what I was really looking for. And I thought I would be here for 3 years and be gone. I remember I was, my parents had moved to Florida and I was on winter break. I came in from the pool visiting my parents and my father was watching one of the football games and I said, "Who's on?" He goes, "Oh, it's Oakland and the Browns." And then the announcer, it was a famous playoff game where Brian Sipe threw an interception
Oh,
and the
sure. I
Browns lost.
remember that.
And then the announcers are saying it's like minus 30 degrees with the wind chill or something
Right.
ridiculous like that. And I really thought, what have I done?
I'm sure your father looked at you and said, huh?
So, yeah. So I came here. I had a great experience in residency. I met my wife, Lori. And
I think
ended
I
up
remember
coming back.
meeting you a long time ago. You were on, I don't know how many years ahead of Mark you were, but I think you were on your way, you were graduating residency and he was just starting.
yeah. Well, I remember when I left my residency, I spent 3 years in Connecticut as a junior faculty member in their residency program. And then Lori and I came back to Cleveland, and I used to go and precept the residents down.
Oh, well, maybe that
And
was
Mark
it.
was a resident then.
Right.
Yeah.
That's funny. So I want to talk about kind of the elephant in the room, which is the coronavirus pandemic and just how that's completely changed everything about our lives. The fact that we're sitting 6 feet apart for this interview. We all wore masks before we
Yes, we
sat
did.
down, just so everyone knows. But just in terms of being on the front lines of the pandemic as a family doctor and at a major hospital in this area, can you just talk a little bit about your perspective in the last couple months of just how this has changed everything?
Well, it certainly has changed everything. I think not only in medicine, but I think you're going to see in business and as well with everybody working at home. You know, the first thing that you think about is the fear that people had and the risk of working with patients with this unknown virus and how effective it is and what is that going to mean. And that's scary. And then, you know, we were quick to realize that in a lot of places around the country, people weren't prepared. They weren't prepared with the proper protective equipment, PPE. And so, you know, it was kind of daunting as, you know, what do you do and how do we, you know, approach this? I was amazed, actually I'd say more proud than amazed about how the doctors that I work with in the Cleveland Clinic all stepped up. That I still remember was that first weekend in March when it really broke out.
Yeah.
And people were calling our nurses and called Nurse on Call and doing, some of our doctors, as Mark does, was doing virtual visits. And they were overwhelmed. I mean, it was like a 2-3 hour wait.
Right.
And with a couple pages, 200 people volunteered to get trained and start working that, you know, on a Saturday and Sunday and start working.
Right.
And a lot of the doctors have said, yes, I'll step up and I'll go to the hospital if you need me. But you really started to think about, you know, what being in healthcare means and the risk that all of the healthcare workers, not only the healthcare workers, but the first responders are willing to accept in order to do their job.
Right.
And so,
Yeah.
you know, there's a lot of room for pride when you see how everybody really responded to this.
Right.
I'm very, very proud of the way the Cleveland Clinic responded. I think that the leadership very quickly saw the issue. They saw it a little bit before, and they really responded. And we went from, you know, seeing patients, and we had been encouraging our doctors to do virtual visits because we think that's part of the future of medicine. And it was slow to, you know, take on, and then all of a
Right.
sudden, almost like flipping a switch,
Right.
you know, in a week's time, we went from seeing patients
Right.
face to face to everybody doing virtual
Right.
visits.
I know, I remember Mark went in just on a Sunday night. He's like, I think I better go in. I'm like, okay. He turned on the thing and like 75 people were in line. He's like, I cannot do this by myself. And so everybody jumped in and helped.
And I think it really... sorry.
I'm sorry.
Oh, I was just going to say, what you were talking about, telehealth being the future of medicine, I feel like people really are seeing that through now. Like, we are still able to see doctors, and you are still able to manage your diabetes, you know, and other health conditions through telehealth. You don't always have to go in. Maybe it's even made things easier for people who are afraid to go out to be able to use telehealth. I wonder, you know, if you've gotten any feedback from people on the user end about it.
By and large, I think it's been pretty positive. Some people still want to come in, they want that touch, and I think that's fine. But there's been some great examples. A few days ago, I got a call from a patient living in an assisted living. His toes were blue, and the nursing staff was upset. And, you know, and I called, and the nurse walked in, and I said, "Do you have a smartphone?" And she did, and I called, and I was able to do the exam without him having to get out of bed, and well, he was in bed and sitting in a chair, without him having leaving. And if he had left this particular assisted living, he wouldn't be able to come back for 2 weeks because they were quarantining everybody.
Yeah.
But when you think about that, there's been a couple cases like that. I've had A lot of my elderly patients, they love it because they're not leaving their home.
Right.
And it's interesting too, you get a little glimpse into their home and,
right.
the living space and things, which I think also was kind of eye-opening.
Right.
When we were residents, we always did home visits, and we
Right.
always, when we were teachers, we always told our students go do home visits,
Right.
and then you stop.
Right.
And you
That's
get a different perspective when you see people's living
I tell
situations.
the kids it's the 60s all over again. We're just back to we're eating that way, we're practicing medicine that way. It's just,
Yeah, in a lot of ways. Marcus Welby.
right. Getting back to your
What
Marcus
show was
Welby.
that?
Marcus Welby.
Was that the name of the
Oh, now
show?
you're
It
trying,
was-
now
it
you're
was-
trying to make me feel old.
It
Come
was the
on.
Grey's Anatomy of,
It was
an
a,
ER.
it was
right?
No.
a TV show. Was it Robert Young, I think,
Yeah.
was the star?
Okay, so the show was called Marcus Welby.
It's called
he
Marcus
was the
Welby.
name of the
Okay,
doctor,
got it.
and
Right.
he was the local
have-
family doctor. Everybody
We have a
loved
lot of generational things.
He had a
that
great
come
job.
up.
He saw one patient a week.
Wow. So how has, when we talk about how this has changed our lives, it's not like it's changed our lives and then we're going to go back to how it was. Can you talk a little bit about what you see as the future in the next year or however many years before there's some sort of vaccine?
I think it's really unknown. I became a Mike DeWine fan
Yeah.
Right.
overnight because
Wine
I
with DeWine.
was really happy about some of the decisive decisions he made.
Yeah.
We use all kinds of predictive models. And one of the predictive models we were using about how many patients we would have was that at the Cleveland Clinic hospitals alone, we would have up to 5,000 patients in the hospital a day,
Wow.
which is huge. I mean, we have, normally maybe we have 500 in terms of our Cleveland Clinic service and people seeing them, so more throughout. But just for comparison's sake, 500 to 5,000. I looked, I think yesterday, and in Ohio, total so far, there's only been about 4,500 hospitalizations or something like that. So think about how all these things that kind of flatten that curve, and we really did flatten that curve.
Right.
We were expecting as many as 5,000, then it was 3,000, then it was, maybe we could see that the curve was getting lower and lower.
Right.
And at least in our own system, we've only had about 130 to 140 patients with coronavirus for probably the last 3 or 4 weeks. So
Wow.
it's really been stable. Now, when you think about that only, I mean, it's still
Right.
really significant, but compared to what it could have been. My concern right now is, and I think this was voiced by several doctors on the news in the last few days, is that we're reopening things too soon.
Right.
And
That's what I was going to ask.
yeah, we think that when the schools were closed, that had an impact in keeping the spread of coronavirus down. But even bigger than that was when the restaurants and bars were closed. We think that had an even bigger impact in closing the schools. And a lot of us are very concerned about what's going to happen because they're opening up, next week, I think.
Yeah.
What's the impact of that going to be 2 weeks later,
Right.
sometime in June?
Does the clinic or any of the other healthcare company, hospital systems, are they offering advice to the school systems or the state about how to do that?
Well, I think the clinic and the other hospitals are working very closely with the health departments.
Oh, okay.
And then I think the health departments are,
Giving guidelines.
kind of giving that type
Yeah.
of
Okay.
advice. I think things will be better than they were from the standpoint that hopefully people will be wearing, well, I don't have my mask. We'll be wearing their, I took it off for the video.
Right.
We'll be, wearing their
One of
cloth
these.
masks. And I think people will be separated. And I think people have learned to wash their hands and to wash
Right.
their hands for 20 seconds and not to touch a lot of counters and
Right.
not to, So I think people are learning that. How much of that will really occur
Right.
is hard to say.
'Cause
But I
people
think
make
we're going to
attention.
have to do that for the foreseeable future, certainly into, 2021. There's, some hopes of, a vaccine by the end of the year, which it would be remarkable in how quickly something like that has been developed, because usually that process takes much longer. But I think we just have to realize that, to be reasonable, travel is going to be limited, and some of the things we're used to.
Right.
we
What
have to
about the
limit.
testing aspect? That was in the news. There's not enough, and people, friends have said, when are we going to get a test? Do you have any clues? No?
You're right. We haven't had enough testing, and kind of baffles many of us why this country couldn't be prepared to have the testing. At the clinic, we've started testing. We started opening up for same-day surgeries, and so we've opened 3 new testing sites for people before they get surgery to be tested, so we know.
Oh, okay.
They've been working out pretty well. I think what we'll find over the next couple weeks is that we'll start ramping up the testing sites and start introducing it to other people right now. And we think the capacity could be, as many as 3,200 tests a day.
Wow.
in a week's time. I mean, that's what we're kind of working at. And all the other hospital systems
Right.
are doing the same thing. But
Am
right
I
now,
going to my doctor's office for a test? Am I going to a drugstore for a test? How is this happening?
yeah.
Or how do they think it might happen?
Well, so right now, most of the systems are limiting the test to the people who have the highest risk of a poor outcome. The elderly, people who have, chronic medical conditions. Everyone, I think, has heard those. And then healthcare workers, if they're sick, so they're not spreading it. And you're bringing in preoperative patients, I think they're going to have it as well. We are seeing some more sites. Some of the pharmacy chains are starting to look at it and have
Yeah.
plans to open up drive-through testing as well.
Oh.
Again, from what I understand, it'll still be criteria, that they want to get the higher risk patients.
Right.
The problem with us doing it in our offices is the PPE, the protective equipment. So COVID-19, the coronavirus, spreads by it's aerosolized. Now, it can get on a counter, and then someone touches the counter and touches their mouth or their eyes, and you can spread. But it's really spread by it's aerosolized. If you're sticking a swab up someone's nose or, in the throat and things,
Right.
people cough, they move, that's going to aerosolize droplets if they're positive. So it puts the healthcare workers at risk.
Sure.
So in the places where we're doing it, the healthcare providers who are doing the testing are wearing the N95 masks,
Right.
gloves, gowns, eye shields, et cetera. And we have a shortage of that. We want to protect the N95 masks. We're not using them, at least in our system, in the ambulatory setting, because we want to save those for the inpatient setting, again, preparing for a potential surge of new patients. And even though we flatten the curve, we're worried that that's going to come.
Right.
So part of the reason we're not doing it in the doctor's offices and things is to protect the healthcare workers. We've changed our approach even for strep cultures,
Oh,
because the same thing could happen. You're doing a strep culture and someone coughs,
right.
you have to have full protection.
Oh.
So it's kind of changing the way we're approaching some of those
Okay.
things.
Okay.
Just because we're running low on time, I wanted to ask you to sort of relate growing up Jewish and this moment in time when there's the Jewish value tikkun olam, to save a life. And I just wonder if that is resonating with you a lot during this time.
Well, I think growing up Jewish, the idea of helping others and the idea of, doing those things is prime with what we do. There was a time like in high school and college where I was just reading everything I could about the Holocaust and the Shoah and why did this happen and how could people treat other people that way. And I think that's part of one of the reasons going into healthcare. It's like, helping other people, but also standing up for other people. I mean, how can we not take care of this person? How can we leave people at the border? How can we not let these immigrants who are running from other places and, it's sort of treating that. So I think that's kind of ingrained now in terms of, how we think and what we do. And, worry about honestly, I'm worried about my own health, and seeing patients. And one of my sons is a family doctor, and he's working with COVID patients, and I worry, you worry about that. But at the same time, you go to work, and it's just natural that you're going to do what you need to do to take care of people. And it just becomes ingrained, I think, in what we do.
Well, I really want to thank you for going to work every day and helping others. And I really, I know the clinic is doing great work, especially during this time. So just thanks to you and all the healthcare workers who are doing their part during this pandemic.
And thank you for speaking with us.
Yes, thank you so much.
Thanks
I
for
really
having me.
appreciate it. And,
It's always good to schmooze.
It's always good to schmooze.
And thanks for listening to this episode of Cleveland Schmooze.